I think for practicing doctors, it's a very useful tool to help engage people. We know encouraging follow-up is one of the challenges in liver health. I think it would be quite useful to raise it and introduce it quite early, particularly if someone has been newly diagnosed with a liver condition, because I think there's so much well-written explanations of liver disease on the app. I think it would be very useful for someone to read it at their own pace and understand the medical terminology that they're being told around the time of a diagnosis. When people read more about a condition they're living with, they learn more about it, and that often stimulates more discussion with their treating practitioner. So I think having this information handy for a person is more likely to stimulate good discussion with the person who's helping them manage the condition. And I think that can clear up a lot of misconceptions about liver problems and liver health, and lots of issues that people are often too frightened to ask. So things like breastfeeding with hepatitis B, the fears around sharing cooking utensils or cutlery with family members, issues around safe sex. So I think having that information on someone's telephone that they can read at their own leisure and in a private situation, I think is likely to lead to good discussion with people involved in their healthcare. I think the ability to add reminders in for appointments is invaluable, and we know it's one of the challenges in liver health when people are doing very well and their appointments might be 6 months or 12 months apart. Getting people to remember to attend their appointment can be very, very challenging. I like the way that patients can enter in their own results and record their results. I think that's very useful for a lot of people, and I certainly have a lot of patients who ask for printed copies and monitor their liver health very carefully. I think medical students and other allied health students would find it very useful. I think it's got excellent sections that summarise the major conditions that affect the liver, and there's a very useful part that dispels myths around certain conditions, and I think that would be very useful for medical students and all allied health people and doctors to know about those myths and to even upskill about various conditions. So I think that's a very, very useful tool for both people with a liver condition and also health practitioners to use.